Hello, everyone. My name is Erin Cochran with the UWS Advancement Team. Today, I'm happy to be joined by members of our UWS Doctor of Chiropractic program. Please join me in welcoming Dr. Suzanne Lady, Dr. James Strange, Dr. Kathryn Ross, Dr. Chad Lambert, and Dr. Christine Major. So one of the top things that incoming DC students are interested in learning more about is who they will have as instructors at UWS. With that in mind, let's go around and please provide a personal introduction and which course or courses you teach.
Hi, I'm Dr. Suzanne Lady. I am a graduate of, at the time, it was Western States Chiropractic College back in '97, way long ago. I have almost 20 years of practice experience, and I've been teaching at Western States for about 10 years. I currently teach in the clinical ed department in the College of Chiropractic, and over the course of my tenure working for UWS, I've served as department chair and chair of the Learning Assessment Committee. Let's see, some of the courses that I teach are early in the program, and they focus on communication and listening skills, as well as patient interviewing. Towards the end of the program, I teach a course that focuses more on clinical thinking and reasoning. Some other things that I do, I help manage our student remediation program, and I also co-manage a program called Clinical Standards, Protocols, and Education. Don't worry about it. It's you'll learn about it as in time. And then finally, I volunteer for our mind body medicine elective that Q2 students have an opportunity to take.
All right, and I'm Dr. James Strange. I'm an associate professor in the Department of Chiropractic Sciences. I initially graduated in WSDC like Dr. Lady in 2007. From that point on, I was asked to be a teaching assistant. So I was a teaching assistant up until 2011, whenever they offered me a full-time faculty position in the clinic. So I was a campus clinician for 7.5 years, and then in 2018 transitioned into the classroom. Currently in our department, I teach a lot of the extremity courses. So extremity joint play, manipulation, the review course that goes along with that, upper extremity diagnosis and management, as well as the rehab portion, more specifically advanced rehab. So kind of blending a little bit of classroom or clinic experience into the classroom to help kind of drive and foster that back into the clinic.
Hi, everybody. I'm Chad Lambert. I am a '03 grad of what at the time was Western States Chiropractic College. I've practiced in Oregon and Arizona. I was in full-time practice for about 10 years. And then I moved back up to Portland here to practice with a good friend of mine. And I started working as a TA at the school in 2012. In 2014, I became a full-time faculty member here, and I've been full-time since. I'm primarily in the clinical education program, which is kind of in the middle of the program where students are learning a lot about evaluating patients and treating them. So I do some of the orthopedic classes where we're evaluating joint disorders, and I do some of the treatment classes like chiropractic adjusting and other techniques. I'm also involved in our simulated patient program, where we have students in the third academic year of the program seeing simulated patients. So these are actors that come in and they pretend to be hurt or sick, and our students interact with them and do a diagnosis and try to write up a management plan. And so it's a really, really important part of the program. So I'm really happy to be involved with that. And yeah, but I get the opportunity to be in a few different departments in my time here.
Hi, I'm Dr. Kat Ross. I'm a clinician and assistant professor here at the University of Western States. I graduated from UWS in 2009, and I have been in private practice for about 6 years before becoming a clinician here. Been a clinician now for 5 years. And so basically what I do is I work with interns once they get into the clinic, and I oversee patient care. So guiding students to treat patients, learning how to treat patients, how to give our patients the best care we possibly can. On the side, I also am a gymnastics coach. So a lot of what I work with in the clinic are youth athletes and trying to give our students just a different perspective on different patient types.
Hi, everybody. I'm Christine Major. I am an associate professor in both the basic sciences departments and the clinical sciences departments. Also a UWS grad. My background is neuroscience, so I went to graduate school for neuroscience prior to coming to the University of Western States. I've been teaching since 2014, I initially started teaching as an adjunct faculty member while I was still practicing, and now I'm a full-time faculty member. My courses, as you can guess, are neuroscience courses. So I get to teach at the beginning of the program, teaching things like neuroanatomy, neurophysiology, so the structure and the function of the central nervous system. And then I teach a little bit later in the program, and it's a more capstone class. So we talk about different pathologies that relate to neurology, and we kind of tie it back to that neuroscience, that structure and function that we originally talked about early in the program. It's really fun stuff, and I look forward to meeting you.
Awesome. Thank you all so much. The second question I have for you is, how do your classes prepare students to be great chiropractic physicians?
I can probably start with that. So I teach a course early on in the program that starts to focus on communication and listening skills, both verbal and nonverbal communication skills, and how to improve those skills by working with peers and standardized patients while learning how to conduct a patient interview. So that's one of the courses that I teach early in the program. And then later in the program, I'm with Dr. Lambert, and he alluded to the standardized patient program. There's a series of a course series called clinical training phase courses, and that's where the students learn to put it all together. They take what they've learned at that point in time from all the preclinical courses, and they learn how to connect the dots. And the process starts of learning how to diagnose and how to manage certain simulated patients that come in, like Dr. Lambert had said. And in these courses, what happens is the student starts to build professionalism, communication skills, diagnosis and management skills that they're going to use their entire practice careers.
Primarily, the courses I teach are the extremity courses, and that's normally in year 3. So 6, 7, 8, and 9 are kind of my primary courses, although I've taught earlier than that as well. The courses that I primarily teach help to kind of address the treatment approach to those. So the adjusting primarily, but then also taking what they've learned in basic science and continuing to apply that, what Dr. Lady mentioned, as far as professionalism in the treatment aspect of that. So doctor-patient position, how to be, an effective adjuster, but then also the communication aspect of that whenever you are actually treating. So kind of taking it to that next step and preparing them for the clinic. And so we're right before the clinic, so they get those experiences and hopefully are able to translate that into the clinic.
And I'm in a lot of classes, or at least a handful of classes with Dr. Strange and some of the associated labs. And so, yeah, the courses that I'm thinking of that I tend to work with regularly are assessment and treatment. So a lot of what Dr. Strange said there, learning to evaluate patients for injury, trying to figure out what is wrong, what tissues are injured, so then we can then deliver the most effective treatment. And then transitioning into treatment courses. So sometimes you'll see me in extremity adjusting or cervical adjusting and get an opportunity to talk about that next step. So not just figuring out what's wrong with the patient, but then starting to treat. And then kind of one of my last interactions with the students is in the simulated patient program. In the middle of that program, it's a 3-course series, and we take that time to synthesize, right? So you're going to have patient history, right? You're going to come in, you're going to see a patient, and you're going to take a full history, and you're going to do an examination that's appropriate, and then you're going to come up with a diagnosis. And then we get an opportunity after everybody has seen their patient to go and have what's called a debrief and talk about the case. And it really just gives an opportunity to synthesize some of those things you learned. Sometimes we learn things in little bits. And when we have a comprehensive course like this, gives us an opportunity to put things together. And this is all happening right as students are starting to transition into clinical care. And so it's a nice kind of last set of courses before our students are becoming interns and going and starting to treat patients.
All right. And so the clinical internship, what I am a clinician overseeing, so that's a 5-course series. So 5 quarters starting in quarter 8. Okay. And this is really where you will have the opportunity to put everything that you've learned into action. So actually getting to apply that to patient care. I'll be there to guide you, as well as other clinicians, and give good feedback. And then, really get to see all that work that you've put in to your education, really get to see it play out as you get more confident seeing patients.
So my goal in the basic sciences, as well as the other faculty in the basic sciences, is to provide students with foundation that's going to eventually support your clinical learning and in practice. So the basic sciences covers things from gross anatomy, histology, cell biology, neuroscience, microbiology, genetics, immunology. So we understand how the structure and the function of the body, the systems of the body work typically. And we also have integration. So we weave in different pathologies. So we know what the structure is supposed to look like. We know how it's supposed to function, but what happens when things go awry? And that's the foundation of the pathologies. So it's important for us to understand how it typically works to better understand how it may work when something goes wrong. This prepares students for the future of personalized integrated healthcare.
The last question I have for you all is, what is one tip you can give students that will help them succeed in the Doctor of Chiropractic program at UWS?
I can jump in there. One thing that I think is really helpful when you have this much information coming at you, you've got these many courses that you're responsible for, is time budgeting. Time budgeting is going to be really important because we're going to have time that we're in class, physically in class, either a lecture hall or in a lab space. And then we're going to have downtime in between sometimes or at the end of the day. And you're going to have a variety of courses and they're going to be delivered to you in different ways. There's going to be material for you to review. There are going to be lecture videos or learning videos for you to watch. There's going to be in-person interaction in multiple different ways. And you've got to make time for that during your week. And the best thing you can do is create blocks. If you can create little blocks where you say, okay, for this hour on Monday when I don't have classes, I'm going to spend an hour just focusing on biochemistry, right? I'm going to be studying biochemistry for 1 hour, and then I'm going to switch to something else. Whatever it may be, a different science or a clinical science. To go through and kind of create these schedules throughout your week, I think you get enough time to get your studying in and still have time for leisure activities and exercise and all those things that balance your life otherwise. So not kind of letting things slide until we get to a midterm or something like that, but putting little bits in every week can go a long way to really help you out.
So I would say that the tip I would have for students is to come into the clinic early on in your education. If you're a quarter one or quarter two, get into the clinic, experience what's going on in there. The upper quarter interns will soon become, your helpers, and they can help guide you along the way. And then you get an idea of what's going on in the clinic. You can experience different modalities, which will then help to just broaden what you can offer patients as well.
Yeah, I would advise to think of it as a marathon and not a sprint, right? It's preparing you to be a doctor, so it's a doctorate level course. There's going to be times where it feels tough and strenuous, but that's the process, right? The other thing is enjoy the process, right? You're not just getting through it to get through it, but you're learning things to better prepare you at the end, taking everything that you've learned in each day, kind of building upon that, and then over the course of time, becoming a chiropractic physician. The other thing I would suggest is you also get out of it what you put into it, right? So if you're just going through the motions and trying to get done with the course or the program, that's one thing. But all of these courses and everything build upon each other, and it's making you a better, well-rounded physician. And in the end, you look back and you realize, wow, I accomplished something pretty substantial or major in my life.
My advice to any student in the program, and if you're in my class, you'll hear me say this, it's pretty general. One of my rules is don't SIS. And SIS is suffer in silence. And I say that because there's so many folks who are rooting for you, who want you to succeed, who are there to help. That includes your professors, that includes staff, student services. We're all here to help you along in the program, to help your learning. And if you have a question, always ask. We've heard it all. And chances are, if you have a question, someone else has the exact same question. If you don't get your initial question answered, sometimes the material builds on itself. Often it does. And if you've missed a key feature, weeks ago, you might be lost now. So again, everybody is here to help you. Always reach out if you need assistance, whether it's content or it's a different type of services. We're all in your corner.
Those are really good tips. I don't know that I have any more to add, but I'll try. So maybe a couple of things to piggyback on what James said, you know, you're not here for a very long period of time, but it feels like a marathon at moments. So I think that it's really, really important to start looking at how you present yourself, start to transition into becoming that doctor from day one, because you don't want to wait until graduation day. And what I mean by that is really have some self-reflection on how you speak to others, what your appearance is, how you portray yourself to other people. Start acting professionally from day one, emulating that doctor that you want to become. And the second thing I would say, which is really important for this type of a program, you're going to have so much information coming at you at lightning pace. Learn to study properly. You may have different study techniques that you need to implement in the earlier parts of the program, and that might look different in the later parts of the program. So definitely doing things like highlighting and rereading notes is not evidence-based. We know that that's not the proper way to study. So you want to get a study mate and make sure that you're quizzing each other on the material and you're not just rereading to cram for an exam.
Thank you all so much for joining me today. If you have any questions about the DC program at UWS, please don't hesitate to reach out by checking out the UWS website, uws.edu, by emailing admissions@uws.edu, or by calling 800-641-5641. We hope to meet you soon.